Hello, my name is Ian Houlihan, and I'm going to give you a brief overview of my project, the proof of concept for a novel photonic lithotripsy treatment. Kidney stones. They affect approximately 10% of Americans, and as you can see from the map on the right, it's quite prevalent across the United States. It's about a 10 billion annual cost to the healthcare system, and the current stone management techniques have several limitations. Two of the main techniques used by clinicians today is shockwave lithotripsy and laser lithotripsy. To look at these techniques in a little more detail, shockwave lithotripsy requires radiation exposure to the patient in order to image the stone and be able to locate it. They have poor stone free rates, they leave behind residual fragments, and also many patients are not eligible because of their body composition or the type of medications that they're on. With laser lithotripsy, again, radiation exposure to the patient to image the stone. It requires direct stone contact in that the laser fiber tip has to directly contact the surface of the stone. There is stone retropulsion, which is the stone moving away from the laser fiber tip as the laser pulses. They also need specialized outlets to power these lasers. And in the clinic, it has been shown that patients have received thermal damage to the kidney tissue using this technique, and also a lot of post-operative pain has been reported. We saw a need to be met here, so what we are trying to introduce is photonic lithotripsy. And what this technology is we take a kidney stone, we coat it with photonic nanoparticles, we irradiate it with a near-infrared laser. This near-infrared laser causes nanobursts from these photonic particles, which in turn cause the stone to fragment. Now, there are three important points to note here. Firstly, this is a non-contact method. The laser tip does not have to be in contact with the stone surface. Secondly, there's more than one photonic property of these nanoparticles. They have a photothermal and a photoacoustic effect. So we have two mechanisms at work here in order to fragment the stones. And lastly, the laser fiber used for photonic lithotripsy is much larger than that used in laser lithotripsy in current clinical use. So we're able to irradiate a much larger area of the stone surface at a given time. To look at some of the in vitro studies we've done to date, here are some stones that we've tested. You can see from the table on the bottom that they are different compositions of kidney stones. A is a control in that it hasn't been treated with any nanoparticles, and B through F have been treated with nanoparticles and irradiated with a near-infrared laser. So you can see control sample doesn't break, and B through F have some form of fragmentation or damage to the stone. So we've been able to show that we can fragment these stones using this technology. So the next steps for the project are to dig deeper into this mechanism of failure and gain a greater understanding as to how this is happening. With that, I'd like to thank the lab group and also acknowledge our funding sources. Thank you.